Hi, my name's Jack. I'm a doctor of physical therapy student here at Rocky Mountain University. The plan for today is I'm going to show you how to set up some E-stim, specifically Russian stimulation to try to regenerate muscle growth, kind of overall tone and strength. So today we're working with a 66-year-old patient who is 3 weeks post-op on her left knee, getting a full knee replacement. So a couple precautions that you want to look out for before you do this. You want to make sure that the patient doesn't have any impaired skin sensation, especially in the periphery. You want to make sure that the patient is able to communicate with you, make sure that their cognition is up to standards, and make sure that there's no cardiac dysfunction or history of epilepsy or seizures. A couple times when you never want to use this is when the patient is pregnant, they have an active pacemaker, active tissue infections. You also want to make sure that they don't have any active peripheral vascular disease and they're able to comprehend the instructions that they're giving them. So with that being said, we're going to move over to the E-stim machine. I'm going to show you how to get it all set up and apply it to the patient. So when we're getting the E-stim machine set up, we are using a Russian bursted modulated alternating current. So there's going to be phases when the current is on with a little break to ensure that the muscle gets to rest so we can ensure a strong contraction. For pulse frequency, we want to make sure we're at 50 pulses per second. Pulse duration is always between 200 and 800 microseconds. We'll be aiming for 200 today. And the pulse amplitude or intensity is going to go up as high as the patient can tolerate. The ramp up time, we're going to change to 1.5, making sure we are on the Russian mode. And for the carrier frequency, we're going to try to be within 100 to 2500 hertz. The burst modulation is between 2 and 10 seconds. Since we are stimulating a bigger muscle, we're going to use larger stim pads to ensure that the patient is comfortable. And with that being said, I'm going to show you how to get the electrodes set up on the patient before we start. Awesome, we're here with Ashley. How are you doing today? How's that left knee feeling?
It's doing fine.
Okay, so the plan for today is we're gonna do some E-stim on that left quadricep of yours. So I placed the pads on her left quad, as you can see, making sure that there's enough space in between each pad that we can fit 2 separate pads in between each. So the plan for today, Ashley, we're gonna stimulate for about 10 minutes. We're gonna aim for about 10 contraction during the stimulation. You shouldn't feel any kind of sharp pain, but it will kind of be shocking. And I'm aiming to try to get a strong muscle contraction out of that quad. Are you okay with all of that?
Yes.
Awesome. So what we are going to do is we make sure there's no kind of abrasions and you're not pregnant or you don't have any vascular disorders or active infections or cancers, do you?
No.
Awesome, so we're all set to go. So when we start the machine, we're gonna ramp up the intensity until we get a strong muscle contraction in her left quad. And then we're going to do a 10-second contraction with a 50-second break to give good break towards the muscle so we can have a strong contraction for the next stim. So you ready?
Yes.
Awesome. So we are going to gradually, not too slow, increase the intensity.
I'm feeling the tingling.
Okay, good. And we're just going to keep that intensity up until that stimulation is strong enough to straighten her leg. How are you feeling?
I'm feeling good.
Good. So it's important to continuously check up with your patient while you're E-stimming, just to make sure we're not getting too strong of a contraction or just stim in general.
I'm really feeling it.
Okay. And as you can see, her leg is starting to want to contract, and you can see the contraction in the muscle there, but we're aiming for about 50%. Awesome. We got to 50 on the power and intensity, so we're going to start that timer. And Ashley, when you feel that contraction, I want you to try to activate that quad and try to straighten that leg until the contraction is done, okay?
Okay.
Awesome. So we're on that break period now. So we have about 40 seconds left out of that 50 until that next stim jumps in, okay? And
Okay.
just a reminder, try to straighten that leg when that stim turns on.
Sounds good.
Awesome. You can see the countdown here. We should be stimming in about 20 seconds here. How's your day been?
It's been good.
Good.
It's
Nothing.
nice and early.
Yeah, it is nice and early. It's nice to get the day going though.
Yes, definitely.
Awesome. And that contraction or that stim should jump on here in a couple seconds. Nice. Good contraction there. Hold that. Keep it going. Perfect. And we're going to do this for about 10 minutes to try to aim for 10 contractions total. So you want to aim for 10 to 20 contractions during a session. So we just finished with 10 minutes. How are we feeling, Ashley?
Great.
Good. So you want to use E-stim when we are kind of in that inflammatory, going into that proliferative stage of healing after surgery. So we want to get a muscle contraction just to avoid atrophy after the surgery and to ensure a good recovery since we are not allowed to kind of activate that muscle and put strain on the tissues by themselves right now until they're fully healed. So when we are finished, we take the pads off, making sure the machine is turned down. Once we lay the pads down, we just want to check for abrasions, any marks or burns on that leg. And how are you feeling after all of that?
Good.
Awesome. Well, good session there. We'll progress into more kind of active stuff in the future and get that knee feeling better and make sure that we get that full extension back.
Awesome.